Good afternoon, everyone, and welcome to the Multicultural Media Online Conference. I'm Jesusa, Helaratne, Deputy Director of the New South Wales Multicultural Health Communications Service. And in behalf of New South Wales Health and Multicultural New South Wales and our service, thank you very much for joining us today. We have this afternoon New South Wales Health Senior Medical Advisor, Dr. Fizzell, who will provide COVID-19 updates and will answer all your questions. I am joining online as I have been identified as a close contact and have had a COVID test today and waiting for my results. We would like to begin by acknowledging the traditional owners of the land where we are all meeting from today. I would like to pay respects to elders past and present and emerging and extend that respect to Aboriginal elders and colleagues. We would like to acknowledge the elders from all multicultural groups represented on this online briefing. We would like to request if you can please keep your microphones on mute as we hear updates from Dr. Jan. As we only have 30 minutes for this multicultural media conference, we'd like to thank you for submitting your questions in advance. And if you have additional questions, please add them to the chat and we'll try our best to have them answered today. It's my pleasure now to hand over to Dr. Jan. Dr. Jan, how are you today?
Well, thank you, Jess, and good afternoon, everyone. And thank you so much for joining us for our update. Today, we can report that 94.9% of people aged 16 and over have had a first dose of COVID-19 vaccine and 93.4% have received 2 doses. Of the people aged 12 to 15, 81.5% have received a first dose and 78.1% have received 2 doses. So it's really important that we keep encouraging our teenagers to take up that offer of vaccination. It's also really important that for people who've had their second dose in the last 5 months, that they do book in and have their booster dose as soon as possible. It's really important, particularly for providing protection against the Omicron strain. So please, if you have people in your community who are eligible for a booster dose, it's particularly important that they do get that dose done as soon as possible. It's available through GPs, pharmacies, and New South Wales health clinics. Sadly, we're reporting the death of 2 people. We express our sincere condolences to their loved ones. And I do need to stress that we still do have people being admitted each day into our intensive care units and passing each day. It's so important that we keep COVID safe. We've had 3,763 new cases of COVID-19 in the 24 hours to 8 p.m. last night. And as we come together towards the end of the year, no matter our background, we know that this is a time for people to gather together, to have a rest and to recuperate, to join with family and friends. It is particularly important that we try and stay as safe as possible. Wear a mask when you're in an indoor setting where you can't physically distance. It's really also important that people do remember that COVID still has a risk. If you've been exposed, for up to 14 days after you've had that exposure. If you've been vaccinated and you've had that first 7 days, even if you're unvaccinated, you can leave isolation. But it's so important that you keep monitoring for symptoms in that second week, simply because about 25% of people can become symptomatic in that second week and can still spread COVID. So please do remember, COVID is still out there and COVID can still cause problems. It's really important, though, to remember that for most people, it is a mild disease, and we'll see that movement to self-management at home for people who are at lower risk of having severe outcomes from COVID-19. It's really important that you don't get retested after your positive diagnosis unless you're advised by a clinical team. But it's also important to understand that we'll be looking after people so that after they've had their COVID test, they'll be receiving a message from New South Wales Public Health. We'll check to see if you've been in a high-risk venue, a high-risk setting, and we'll interview you and look after the people who you may have spread COVID to inadvertently. If you are COVID positive, we'll also send you a message from our clinical teams. If you're in a lower risk group, so you're younger, you've been fully vaccinated, you'll probably be able to manage your COVID quite well at home. Of course, if you become really unwell during that time, that care is there for you. People who are older, people who are unvaccinated, people who have other health conditions, or people who are pregnant will still remain under the care of New South Wales Health Services, and we will certainly be reaching out to you during that time. It's really important, though, that when you get a message from New South Wales Health, people are encouraged to respond to that message to help us understand if you're in a higher risk group. People will be automatically able to leave isolation after 10 days. They'll get a message from New South Wales Health, and as long as they have had no symptoms for 3 days, they can go back into the community, even after their COVID diagnosis. I think that's a good summary for now, Jess, and we can move on to questions if you like.
Thank you so much, Dr. Jan. I'll ask the same one question from Keith Tan from the Australian Chinese Daily. Without contact tracing, how can we know where COVID-19 was contracted? Dr. Jan.
So we certainly haven't stopped contact tracing. It's really important that people understand that the messages that New South Wales Health is sending out to them after a positive diagnosis are helping us understand where people may actually give COVID-19 to, so that we can actually make sure that those places have a warning. So somebody who's worked in aged care, somebody who's worked who works in a hospital, for example, those are higher risk settings, and we will certainly be contact tracing in those very high risk vulnerable settings. We're also doing some work where we match people's check-ins with our testing data, so that if we see that there's a large volume of people who've been in a certain place at a certain time, we try and let the public know. So you'll have seen some of those messages going out in the past week. But generally speaking, what we all have to do is remember that at the moment, COVID is in many, many places. When we go out, we just need to behave as if though people around us may have COVID. And so that just means making those safe choices about thinking about, if I'm indoors, do I wear a mask? And generally, if you're indoors and you absolutely cannot physically distance, you should certainly have a mask on. If you're in a circumstance where you may not be able to physically distance, wear a mask. You might not have a public health order, but you don't need a public health order to make those decisions about making, adult decisions to wear a mask and protect yourself when you're out in the community. Similarly, those sorts of things are what we're doing to help protect ourselves, making choices about, do I go into an indoor crowded venue? Do I go into a less crowded venue? All of those things are things that we can do to take control for ourselves and make sure that we try and stay as COVID safe as possible over the next few weeks.
Thank you so much, Dr. Jan. And where could we get this information, especially now holidays are coming up, and where could the community get that information?
So we're doing as much as we can to help keep our information up to date. There's been a lot of rapid change. It reflects the fact that we've had this large number of cases, and so we're trying to make sure that we are targeting the most vulnerable people to make sure that they get the care and attention that they need to stay safe. It's really important, though, that we're trying our best to keep our information up to date on the web, so that the New South Wales government website is where you go to get key information that will help you understand what's happening and to stay up to date with changes as they occur.
Thank you, Dr. Jan. I guess, as you said and mentioned, there's a lot of cases of COVID-19. What happens, can you please explain, there's a question here, what happens when a person has been tested with COVID-19? What is expected?
So when you've been tested positive for COVID-19, you'll get a message from New South Wales Public Health. So first of all, you'll get a message from the lab telling you that you've tested positive. You should also get a message from New South Wales Public Health asking you to identify if you're in any high-risk settings. If you're in a high-risk settings, we prioritise you for interview within the next 24 hours. Otherwise, we'll just provide you with advice about self-isolation so that you don't cause problems for other people in your household, but also who you need to let know that they've been in contact with you, so that they can also take steps to protect themselves and the other people around them. You'll also get a message from our clinical services, and our clinical services will let you know how to get help, but also to let us know if you're in a high-risk group where we need to be providing you extra care. Some of those people will be identifying automatically from information that we already have within New South Wales health systems. Most people who've been to hospital will have a health record that is across our New South Wales health systems. We'll be able to identify your risk of being high risk, and we'll take you immediately into our high risk program. But for other people, you'll be self-managing at home. There will be some people that we will not pick up through that profile, say they've had all their care somewhere else, interstate or so on, in which case we've asked people to call a special number to receive care. You do not need to call that number and you do not need to worry if you haven't had a call from New South Wales Health. We're not calling everyone anymore, just people who either are at higher risk to other people because of the work they do or where they've been recently, or people who are at high risk themselves so that we can provide that clinical care. Not everyone will have a call anymore, but we are taking note of each and every case.
Thank you so much, Dr. Jan. I am isolating, although I was notified as a casual contact. And so I've got vaccinated, did the right thing, got vaccinated, got a negative test, but after 6 days, got to do the test again. How important is it to follow these rules?
Look, it is really important to follow this public health advice, and simply because COVID is an infectious disease, we give our advice based on how the infectious disease behaves. There are lots of infectious diseases that we give similar advice to. So say you had measles, we would give you advice about staying isolated away from other people so that we don't give them measles. So it's really important that we understand that it's not unusual for public health physicians to give you advice to try and help protect yourself and the community. So if you're asked to have tests at a certain period of time, that helps you understand whether you're going to become positive or not. It also means, though, if you've got symptoms or if you're not quite sure that it's happened, sometimes we'll detect your disease quite early. And that's really important, particularly for older people who may become contacts in the near future. It's really important because there's treatments that we can offer to people who are medically vulnerable that are particularly effective the sooner after infection that we can, and symptom or test onset, that we can give them to them. So that's why it remains important for people to keep getting tested if they've got symptoms. And if they're told to be that they're a contact, it helps us get them earlier in that disease course.
Thank you, Dr. Jan. But what if you've already been vaccinated with both doses and have been tested with COVID? Is there different advice to those who have not been vaccinated?
Generally, at the moment, Omicron is able to spread amongst the vaccinated population, but people are not getting severely ill. We still don't know what Omicron looks like in an unvaccinated population that hasn't had extensive experience of COVID. So even though in New South Wales, I know it feels like a lot of people have had COVID compared to overseas communities like South Africa or the UK, most Australians have not had COVID, whereas in some of those other countries, the number of people who have had COVID is significantly different. So in our unvaccinated population, it's really, really important for people to follow that advice, and particularly to respond to those text messages from New South Wales Health, particularly from our clinical care team, so that we can assess whether we need to offer you treatment to help prevent you coming into hospital.
That's really important, Dr. Jan, because once you've been tested COVID positive, what support is available for those who are self-isolating?
So there's a welfare line that you can call, and they can help with things like groceries and so on. But what we'd really encourage people to do is, knowing that the case numbers are growing, is wherever possible to, again, refresh those family and friend networks, refresh those COVID safety plans that you may have put in place 2 or 3 months ago. You may have stocked some things up that you've now used. Have a think about whether you can just put a couple of things aside each week to try and keep building up those stocks again, or else talk to your family and friends about what your family and friend network plan is to support each other should someone have to isolate from COVID-19. It's really important that we keep looking after each other. And I think that's something that our culturally diverse community has shown their particular strength. They have looked after each other so well during this pandemic. And it's something that we'll need to keep doing for some time yet. And so I think making sure that those links are still there, that people are still able to reach out to each other, will stay really important into the future.
Thank you, Dr. Jan. We have a question from Kif Arkis Nissan from Australian Social Services. The question is there surging numbers of COVID infections on a daily basis, and might be in the new year or thousands of cases per day? Is there an opportunity for a snap lockdown for some places such as community hubs and community halls? What else would the government plans to deal with these surging numbers? We're unable to answer those questions in terms of restrictions and of government. But Dr. Jan, what's the health advice for just keeping safe?
Look, I think the thing is for people to be really aware that we do have really high numbers at the moment, And so doing things like encouraging people who are gathering together in a community hall to wear a mask, review your COVID safety plan. You might not have to have one under a public health order, but even if you just keep a list of the people who might be at a meeting and so on, if you then find out that someone's COVID positive, you can then let the people who are at that meeting know that they may have been exposed so they can take those steps to protect themselves. It's really important that we don't sort of go, oh, COVID's over. It's not. Those things that we've been doing because we've had public health orders in the past can still help us keep safe into the future. So keep thinking about what can I do to keep promoting vaccination and booster doses in my community? What can I do to keep our gatherings COVID safe? What can I do to encourage people who have symptoms to not come to meetings, even if they might feel otherwise obligated to? Because I know some people who are really socially minded, up until before COVID, it was a real mark of honour to drag yourself out of home when you were feeling really sick to go to a meeting and make that commitment that you had made to other people. Now with COVID, we need to make sure that we keep some of these flexible meeting options available to people. So you'll see Jess and I today, this is not how we normally do this broadcast, but because we've been able to put this flexible option in place, we're still able to function even though Jess is isolating and I'm here at work in the office. So I think it's important that we don't dismantle our Zoom infrastructure and all those things so that people can still be involved, even if they've chosen not to come out because they're not feeling great today or because they've been told to isolate, or even if they don't have to isolate, they don't want to come to a meeting with, say, a number of older and vulnerable people. It's really important that we keep supporting each other into the weeks and months ahead to keep some of our COVID safe behaviours going to reflect what the level of risk is in the community at the moment. At the moment, our big risk is we do not know what Omicron's going to look like. And we also know that we've got a large number of Delta cases in Sydney in particular. So it's really important that we don't go, oh, it's all Omicron, it's mild, we don't have to worry. We do need to remember that Delta is still around in Sydney at the moment and people are still becoming hospitalised and going into ICU with it. So we still need to keep some of our flexible functions available to look after each other.
Thank you so much, Dr. Jan. I think that's important that we are seeing a lot of cases who have COVID, but what's the messaging for the communities for people who have had COVID and how to support them as friends and families without discriminating or being, the messages should be positive, isn't it?
Look, absolutely. And what we really know at the moment is even people who are doing everything they can to stay safe, the COVID, particular Omicron, is so contagious. It is really easy for people who are trying really, really hard to even become exposed and to become sick with it. So it's really important that we get this message out that even people doing all the right things can get COVID. But the other thing is, after somebody's been cleared and has recovered, they pose no risk to the community. And there should be no shame about having had COVID. It's not something that anyone wants. But I know that even here in our public health response branch, for example, we've had people who have had COVID and people who've had to isolate from coming in contact. And all they've done is just been normal people, being particularly careful, and it still happens. So it's really important that people understand that they haven't necessarily done anything wrong. But wherever possible, what we should do is ask people who have a sniffle, who come to a meeting and just sort of say, should you be here? And some of them will have hay fever and they'll say, I've got hay fever, and okay, that's great. And other people though will say, yeah, I'm not feeling that great, in which case that's a great time to say, look, I'm really glad you could come, but could you, maybe we'll catch up next time, rather than staying there with those symptoms. It's really important that if we've got symptoms, we isolate. And it's the same thing, coming into the next couple of weeks, some of our testing clinics may not be open quite as long hours. It'll be really important that you don't get impatient and leave. It's really important that you isolate until that testing centre is available to you, go and get tested and isolate till you get those results. It's a small sacrifice to make to keeping the people you care about most safe.
Dr. Jan, there's a question from Russell Anderson from NEMBC. He's asking about the total number of Omicron cases we've had in New South Wales. And are we seeing a doubling of these cases, 2 days of like Omicron cases like in other countries?
So what we're seeing from our testing is that we definitely don't have all Omicron. So we haven't had a complete displacement of Delta for Omicron. We're seeing in certain regions. So for example, around Newcastle, there's a significant proportion of that community who has the S gene dropout, which is a hallmark of having Omicron. However, in other parts of New South Wales, it's probably about 45, 50%. So it's certainly not yet the dominant strain. And the concern is we certainly have a significant amount of Delta in our community, and Delta has been the one that has caused us so many problems. And we're yet to see exactly what Omicron looks like in the Australian community. So I think it's really important that we understand that there's still disease out there, and we still need to be quite careful as we go about our daily lives.
Thank you, Dr. Jan. And I guess protection is getting vaccinated. And just an update on the vaccination for children.
So the good news is in the new year, there'll be the vaccine available to children aged 5 and over. It's really important that the kids get vaccinated. I know a lot of people say, well, kids barely get sick. About 1 in 3,200. So if you have, 5 local primary schools of a good size, that means that one child in those primary schools could get really, really seriously ill with COVID, such that they wind up in intensive care. So it's really, really important that we don't say that COVID is always a mild disease in children. The other thing that we know is that children have been good at giving it to each other. It's not like it used to be. Old COVID, the kids weren't a big factor, but we also know that children have been able to affect parents and grandparents, and children have also become sick, not just in that first 7 days, but in that second 7-day period. So it is really important that we get the kids vaccinated to protect themselves from, ICU, or even passing on, which we have seen overseas, but fortunately we haven't had those case numbers here, but also to help protect each other. So it's really important that we get kids vaccinated. They have a different dose of the vaccine compared to adults. They have 1/3 of the dose of the vaccine compared to adults. That's enough for the kids' immune systems to do their job. And at the moment, it's a 2-dose course. So really important that the kids get vaccinated when it's available to them. And particularly any child who has a history of, asthma, congenital heart disease, graduated from being a premature baby, any of those health conditions that may have meant that they're often seeing a doctor. Definitely, those kids absolutely need to be vaccinated, but all children should be vaccinated.
Thank you, Dr. Jan, and that's a really important message for parents. But I'd like to ask again, I know we talked about this last week, about the RAT test and how important that is when visiting friends and families.
So yes, and I know it's been a real challenge for some people to actually get the RAT tests this week, and that it's also a challenge for some families to even afford those RAT tests. All I can say is that a day lost from work, a day lost from, having to look after somebody who's sick at home, days lost from work from isolating are also a cost. So I'd really encourage people to think about using those rapid antigen tests before they have large social gatherings, particularly if they know that they've been around somebody who may have had COVID, they haven't been asked to isolate, but just think really carefully in that 2 weeks after that exposure, am I going to see someone? Are they vulnerable people? And by having this test, could I help prevent them having a problem, and can I prevent other people from having a problem? So those rapid antigen tests are fairly quick to do, take about 10 minutes. You do it before you leave home, and then you've got some level of confidence that right at that time you don't have COVID-19. If, however, you have symptoms, please don't rely on a rapid antigen test. We have seen people, they do have a false negative rate that's higher than our PCR test. So it's important that if you've got symptoms that you get the PCR test at one of our testing clinics. So either a walk-in testing clinic or a drive-through testing clinic. Please do not rely on a rapid antigen test if you have symptoms.
Thank you so much, Dr. Jan, for that answer. Francois from Le Courrier Australien he's saying that you don't have to wear a mask or register QR code is not a message because it's giving confusion for the population. The situation is better, don't worry, or we have to live with it and we will see. is a confusing message, he's saying. In Europe, a lot of countries are already deciding to make it compulsory or thinking to go back to lockdown. Are the risks less important in New South Wales than in Europe? Dr. Jan?
Look, I think the public health advice is if you're indoors, wear a mask. That's the only reason why my mask is off at the moment, is so you can see my mouth and so I'm speaking clearly to you. Otherwise, my mask is on. I'm in an office. I do not have to wear a mask. I choose to wear a mask, and my workplace encourages me to wear a mask simply because that helps us keep each other safe. We know that we can reduce transmission by wearing masks, and it's really important that the public health advice, which is wear a mask, is heard, because they will help reduce transmission. The fact is that we are able to make choices as adults as to what we do. We may see masks come in, we may not, but the key thing is we know that masks can help reduce transmission. So if someone asks me as a doctor, does wearing a mask indoors help reduce transmission and risk? All I can say is yes, but there are many things that doctors might like to make compulsory that we don't do, because the community also has a say, the economy has a say. And so people are balancing different things. But if you ask me as a doctor, will wearing a mask help me reduce transmission? The answer is yes. Will going into less crowded venues be safer than going into a more crowded venue? The answer is yes. And so then people can make up their minds if they're given the information. And I think that's what we can strongly say. And we leave government for government.
Dr. Jan, I think it's still important, and I guess being Dr. Jan, you would be promoting the COVID safe behavior as wash our hands, and also.
And I think this is the thing. You don't need a public health order to wash your hands. It's just the same as we don't have a public health order to tell people to wash their hands after going to the toilet. It's just good, solid advice that it helps reduce disease risk. So again, keep your hands clean. If you're around places where lots of people are touching things, keep that hand sanitizer in your bag and clean your hands before you go anywhere near your face. Wear your mask if you're out if you're in a crowd. Choose about whether you go into a crowd or not. Look at the business. Decide for yourself whether you feel it's safe. You know, if I've got a choice, I've got one cafe where all the hospitality workers are wearing masks, the tables are spaced out, or I've got another cafe where no one's wearing masks and the tables are close together. I make my personal choice as to which venue I want to go into. And I think that's what other people can do as well.
Thank you, Dr. Jan. And any last words? We're running out of time. But any last messages and clear advice for the community and for the media?
Look, I think it's been a really challenging time for all of us. It's been a disappointing time, I think, for so many of us, because we were doing very well as a community at working together to look after Delta. And this Omicron has made it really hard for all of us. Things are changing rapidly. We will do our best to communicate the public health advice. We will do our best to help people have the best information available. And we will keep our websites up to date and hopefully get resources translated as quickly as possible, so these messages are not just in English, but are accessible, not just in the written form, by audio and everything else, as quickly as possible. It has been a time of rapid change, and we're trying very hard to make sure the community is kept as safe as possible during that time of change. But I also just want to thank everyone. It's been a really long, hard 2021. And I know so many of you have worked so hard as advocates for your community, as sources of information for your community. And I cannot thank you enough for the time you have taken to communicate those messages to the community to help them stay safe. And so, you know, from the bottom of my heart, thank you so much for everything you've been doing. And just to say, I hope you have a wonderful Christmas and a really happy New Year, or that you just have a very peaceful break over the next few days. Thank you.
And thank you, Dr. Jan, from the bottom of my heart to you for being with us today, and for always being able to answer the questions, and for doing a lot of community engagement and forums. You've been such a great support to the community and to the media. So thank you. To everyone, this is our last online conference for this year, and we want to thank you for always joining every week for the Multicultural Press briefings. We at New South Wales Health, Multicultural New South Wales, and the New South Wales Multicultural Health Communication Service truly appreciate your support in disseminating the key COVID-19 health messages to multicultural communities across New South Wales. You as multicultural media are crucial in delivering these messages. So we thank you for partnering with us, for traveling, and for coming with us and joining us through this journey. We will return on Wednesday, 19th of January in 2022, and we look forward to seeing you then. But I'd also like to thank Dr. Jan, the staff and teams from New South Wales Health, Multicultural New South Wales, and the New South Wales Multicultural Health Communication Service, because it is a team effort to be able to bring you these messages. The recording of this briefing is available on New South Wales Multicultural Health Communication Service website, as well as all the other recordings. We wish you a safe and happy holiday season. Be kind to one another, take care, and we'll see you again next year. Thank you very much.